All right, now we're getting into the part where we're really talking about the way doctors or really providers and patients interact. So let's think about this doctor patient relationship. What makes this relationship different than other relationships in your life? See, they know a lot about you and you know almost nothing about them. You pay them for their services, often quite a lot. You probably don't do that with your friends. Um, they are experts, and you're supposed to follow their advice without questioning too much. Unlike other market interactions where the customer is always right, there's this idea that no, the doctor is. And you also rarely see them. And when you do, you're mostly actually sick. Not to mention the fact that you're often semi undressed and they are clothed. So, those are major differences in the relationship. So, it's not surprising that providers and patients come at those interactions from very different points of view. But it starts before you enter that room. Um, Doctors have a lot of training, right? Doctors go through high school and college, and they were probably even pre-med in college. Then there's 4 years of medical school, an internship, and then a residency, which vary in length depending on your specialization. So 3 to 7 years. And it also, if I look at this, nursing also, lot of time, a lot of money goes into this, right? Those varying levels to be an RN or a nurse practitioner, a PhD, you're, looking at 11 years of education. And it doesn't come cheap. The average college graduate debt is, 28,500 from a public school, 75,000 for private. Add on to that medical school tuition, where you have 32,495 or 52,515. And you end up with an average debt for medical school graduates of $179,000. And if we look at this from 2010 to 2016, who is going in, who has debt? And actually what we're seeing is more debt for some, but also we're seeing a bunch of people who don't have debt, which may mean that we've got wealthier people going in, and that also has ramifications for understanding different populations. Debt isn't equally distributed across groups. So you're going to end up with a lot more debt if you go into emergency medicine, the far end there, than if you go into dermatology. Okay. And we have to understand that there's a difference too in what you get compensated. So if you are in orthopedics, you are doing pretty well. Okay, so $443,000 a year. Awesome. That's the way to go. If you're in pediatrics, $204,000. Now, okay, look, that's nothing to sniff at there. But again, it may be that this is, first of all, this is over time. And you may have a lot of expenses as well that go into running a practice, insurance, and all of that. We also have to understand that there's a disparity by gender as well. Primary care can be much lower in what you're earning, and especially if you have the audacity to do it while female. And we just see that there's all these differences. So when providers are coming in, they may carry some resentment about this as well. Now, in terms of how providers navigate the world, the medical professionals in front of you are people. And they each took a distinct path that led them to where they are and find themselves there in front of you. They've gone through extensive training and they had to achieve academically to get there. So they're used to having people respect them, and they may even have experienced that within their own families. They're the chosen ones. So doctors in particular are used to having this higher social status, both in society and the hospital setting. And we just have to recognize that this goes into interactions and their expectation of how they will interact with others. Providers have this socialization, and they are socialized in their training, and they're socialized in their experience and what came before in their lives. Though doctors and medical students spend a great deal of time mastering the technical knowledge of medicine, they spend relatively little time learning how to communicate with patients. This is interestingly something that we can see in higher ed as well, where grad schools spend a lot of time training people to be PhDs and researchers, but very little time training anyone how to be an educator. Now, in medicine, we now have nationwide initiatives to improve doctor communication training. Many medical students tend to look down on this kind of training. Oh, that's the soft stuff. It's common sense or unnecessary. But it is not common, and it is absolutely necessary. Not surprisingly, female medical students tend to do better with communication than their male colleagues, especially when given proper training. And that's really because women in general in this culture are socialized to listen, and men are socialized not to. We also see, by the way, that there are, as a result, better health outcomes for patients who have female physicians. So, what are some of the challenges that providers experience? One thing, money. The rising cost of healthcare and the need to view work increasingly in terms of dollars produced and not really the care given, and the added pressures of managed care make life really difficult for providers. There's a ton of paperwork that now goes into medicine. And so providers are feeling stressed that they have to do all of this paperwork, justify their medical decisions to insurance bureaucrats. And of course, a time pressure. With increased time pressures, providers have less time to see patients, and they have to fit more into that time than they really have. This leaves patients feeling dissatisfied, but also leaves doctors feeling like they're not really doing their job well. So, what are some of the tools that they have? Listening, and it's harder to do that when there's not a lot of time, right? But they're listening to what you say. When you go in and you're complaining of a headache, the doctor needs to be able to discern relatively quickly whether this is a serious condition or not, and what's the cause of that condition. So they're paying attention to the words you use. Is your headache throbbing? Is it stabbing? Those words have clinical meaning, even though you might just think I'm throwing away those words. So they listen and they ask questions. And this is really the old way of doing it, is asking questions and listening. Now we run more tests, and sometimes actually practitioners rely so heavily on tests that they don't actually listen to patients either. So when we're thinking about that doctor experience, they're really putting together pieces of a puzzle. Things they may be asking you, things that you consider irrelevant but are diagnostically important, and they're piecing it all together. But there are challenges with this. Sometimes, there's incomplete information. Patients will leave out information for a variety of reasons: shame or embarrassment, different cultural norms, and they may have the inability to communicate, actually, particularly when we're thinking about children. Children or people with mental health challenges, in severe psychotic states, may be unable to communicate. Individuals with cognitive impairment may be unable to answer questions accurately or in a helpful manner. So these are real problems that doctors have to deal with. And there can be this real problem where doctors are assuming that you're going to lie. If you ever watched House, that was a premise, and not understanding why that might be. So there are lots of things that go into these relationships that can complicate them. And then that's even before we deal with the really important aspects of provider bias. Many times, because of all that's going on with providers, they rely on nonverbal cues. And over time, they report that as kind of gut instinct. And that gut instinct, there's really that space where bias seeps in. And this is, leaving aside people who are outright bigoted and racist. People who think they are being thoughtful have biases that come in on a subconscious level. And we have seen study after study shows that social cues and physical cues, such as race, gender, or age, and weight for that matter, affect the kind of communication a provider gives to a patient and the type of treatment options they make available to those patients. There's in here as well, we look at assessments of whether a patient is difficult, has a good or bad attitude. And of course, these are places that are rife with bias and horrific consequences when individuals are judged in this way. We also need to think about stresses that providers are under. Some of this is role conflict, where people have to engage in two or more incompatible roles simultaneously. So trying to give the best care possible to a patient, but also watching the bottom line. Nurses who have to advocate for a patient, but also follow the orders of administrators and physicians. Sometimes it's role ambiguity. There can be stress from this, which is a lack of clarity in terms of the specific expectations of your role. So when doctors and nurses find themselves engaged in more paperwork than actual patient care, or when they're doing work that isn't clearly in their job description. I think we're seeing a lot of that right now with COVID, where we end up with doctors who are, or doctors and nurses who are working in areas of the hospital they never had outside of their specialty. Emotional labor. This is another major source of stress. When your work requires you to display emotions, or actually not display emotions, sometimes that's emotional labor. Be extra happy at Disney World, stern as a debt collector, polite as a telemarketer, but here as a physician or a nurse or any other kind of provider, you have to hold in your own emotions and not show them. How do you show empathy for a difficult patient or appear upbeat when a patient is critically ill or dying? And this can have harmful psychological effects. And we see this right now with providers really pushed to their breaking point in the current environment with COVID. And this we refer to as burnout. This is going to be something we see a hangover from for I think many years. Doctors, nurses, technicians, everyone pushed to the end of their ability, and really with terrible impact on their physical and mental health.